Okay, so here's some information to know about breast augmentation. So first off, there are different forms of breast augmentation. When people think about breast job or boob job, the most common thing that people think of are implants. There are two different types of implants. You have saline implants and silicone implants, but implants are not the only way to augment your breast. So fat grafting to the breast is also an option as well. And so I'll talk about these options and the pros and cons of each. And if you have any questions, just leave them in the comments below. So I'll start off with implants. So as I mentioned, there are two forms of implants. That's either saline or silicone. So silicone is like a gel-like material that you may hear the term gummy bear implants. It's a more natural feeling implant, so it's beneficial for those patients that are looking to have a more natural appearing result. They're softer, they're lighter than their saline counterparts. A saline implant is a silicone shell that's filled with saline water or salt water. It's the same thing that you would get in your IV if you had an IV started. It's non-toxic. If your implant were to rupture, the saline just gets reabsorbed by the body. It doesn't really cause any ill effects if that were to happen. However, it's essentially like a water balloon. So as I alluded to, when it ruptures, the whole breast will deflate. You'll know that your implant is ruptured, and you'll know that you need to go and have your implants exchanged. So a few things to know about implants, no matter which one you pick, is that they're not lifetime devices. At some point in the future, you are going to have another surgery to have the implants exchanged, either because they've ruptured or just with time, things have changed and you need to have the implants, you need to have fresh implants or have things addressed. So with saline, as I mentioned, you'll know when those have ruptured because one breast will just deflate and you'll know that it's time to go have them exchanged. Silicone, however, is not really a rupture. It's more of a tear in the outer shell of the implant. So it still will maintain its shape for the most part. So you may not be able to tell on physical exam when that implant has ruptured. So what the FDA recommends is about 6 years after having a silicone implant placed, you need to get an ultrasound of the implant to make sure everything looks intact, and then you repeat that ultrasound every two years or so to make sure that everything looks intact. Now, if something shows up on that ultrasound concerning for a rupture, then you know to go to your surgeon to have your implants exchanged. So that's it. With the silicone, you just have a little bit more monitoring when it comes to determining whether or not those implants have ruptured. Now, there are things that may show up on physical exam that may be an indicator that maybe they have ruptured, and one of those is something called capsular contracture, and that is when so whenever you put in a foreign body in, your body will try to wall it off with scar tissue. The same thing happens when you place an implant in. And in the breast, we call that a breast capsule, and that's a normal occurring thing that happens again when you have any foreign body that's placed underneath the skin. Now, sometimes the body will lay down too much scar tissue, and that scar tissue will become more firm. Sometimes it can distort the shape of the breast. We call that capsular contracture. Sometimes that happens without any complication with the implants, but it also tends to show up whenever there is a rupture. So that might be an indication, if you notice that there's a change in shape between your breasts all of a sudden that you've noticed over the years, that maybe you have a rupture and or you've developed that capsular contracture. That would have to be addressed with an additional surgery. So those are kind of some things to keep an eye out for whenever you have breast implants. Now, people will ask me, well, how long do implants typically last? I would say the FDA usually gives about a 10-year lifespan for implants, but honestly, I've had patients that have had implants for a lot longer without any issues. My philosophy is if you're not having issues with your implants, they can stay in as long as you're doing fine with them. However, once you develop an issue, then you can come and have them exchanged. However, you will find that different surgeons will have different opinions on when you should have your implants exchanged. So that's just a discussion to have with your surgeon and see what they recommend and what you are comfortable with. Other things to know about breast augmentation with implants is that there are two places where we can place the implant. Three if you want to deal with semantics, but the bigger picture is it can either be placed above or below your muscle. And the little nuance that I'm referring to is if you go above the muscle, there's technically two places where you can put it, where it's either directly underneath the breast tissue or if it's below a tissue that we call fascia or your muscle fascia. Whenever I do a breast augmentation above the muscle, I'm using that fascial layer. But the pros and cons, there are pros and cons to either one, and how essentially I would say if you are a thin-skinned individual or if you don't have much breast tissue, sometimes it's beneficial to go underneath the muscle because that muscle will give you added camouflage to the edges of the implant, and so it will give you a little bit more of a natural look and less noticeable edges of the implant. However, if you're a very active person, sometimes it can be uncomfortable to have that implant underneath the muscle when you're contracting and being very active, because that muscle is now having to contract over that implant, and it may make some activities uncomfortable for you. The other thing is something called animation deformity. So whenever you are contracting your chest muscle, when it's pulling that implant up and down, and we call it animation deformity. For some people that doesn't bother them, but for some it might. And so that's just something to keep in mind when you're weighing the pros and cons of what position you want your implants to be in. Now, going above the muscle is nice because you don't have to worry about the muscle contracting over the implant. You don't really have to worry about the animation deformity. However, if you do have thinner skin or less breast tissue, you may notice the edges of the implant more. And so that's something to just keep in mind. So for me, I tend to make it a very more of an individual type of decision amongst my patients based on their anatomy. If they could go either way, I kind of leave the decision up to the patient. However, if there's anything that I notice, for example, very thin skin or minimal breast tissue, then I may say, hey, I really think you should consider going underneath the muscle. But at the end of the day, it is your choice. As long as you're well educated and you know the pros and cons of either one, then you can make that decision with your surgeon on what would be your best option. So those are kind of the things to know about breast implants. So in regards to augmenting your breast with fat grafting, there are also pros and cons to this as well. So one is, in order to do fat grafting, we have to get the fat from somewhere. So that means you have to have liposuction done. Usually patients don't have a problem with that because they usually have fatty tissue in other areas of their body that they want to get rid of anyway. So instead of throwing that fat away, we can transfer it to the breast to try to enhance the size of the breast. But something to keep in mind with fat grafting is that you do not get the same look as you do if you have a breast implant. A breast implant is a round device that holds its shape when we put it underneath the breast tissue. Fatty tissue is soft, it's malleable, no different than the fatty tissue that you may have in your breast already. It's not going to keep that round shape as an implant does. So if you're going for more of a cleavage look, then fat grafting is not going to be the way to get that result. You're going to want to have an implant that's really going to have that rounded, again, shape to really give you that upper pole fullness and that cleavage look that a lot of women desire. So fat grafting is beneficial mainly for women that or either they just know for sure they don't want to have any implants in because they don't want to have to deal with having to have them exchanged, 10, 15, 20 years down the line. And they're not wanting, they don't care as much about having that cleavage look. They just want a little bit more volume. They're happy with how they look when they're in a bra. They just want to be able to fill their bra out a little bit more. The other thing to keep in mind with fat grafting is that fat grafting is not as predictable as using an implant when it comes to enhancing breast size. So for example, when I put that breast implant in, I know that that's the volume that you're going to have from the day I put it in till the day we take it out. However, with fat grafting, the fat that we put in initially at the surgery, you're not going to keep all that fat. It's no different than when we do a BBL, and I'll have a video about BBLs in the future for you to refer to as well. But when you're fat grafting to any place in the body, you're asking the fat cells to create a new blood supply in a new location. Some of those fat cells just aren't going to make it, and that's fine. It happens. It's just how it is. The body will reabsorb whatever fatty tissue doesn't survive. Sometimes the body may wall off any dead fat cells and what we call fat necrosis. So you may feel little lumps of essentially that walled off fat. So that's also something to keep in mind. But we cannot predict how much of that fat is going to survive once we put it there. We say roughly about 60% or so of fat survives. The fat that we place with fat grafting survives, but it varies from person to person. You may retain more or less. So as far as symmetry goes, there's a higher chance of asymmetries when you're fat grafting because again, you have two different sides. They may retain fat differently. So again, it's more of an up in the air type of situation when it comes to what your final results will look like with with fat grafting. The other thing is we can only place so much fat in at one time, because again, we're trying to ask that fat to generate a blood supply. So if we overfill, then a lot of that fat will not survive. So depending on the volume that you're trying to go for, you may or may not need more than one round of fat grafting to get you to the size that you would like to be. So just something to keep in mind. The other thing is, because we've done liposuction to harvest the fat to use for the fat grafting for the breast, you now have an additional area of the body that has to recover. So as opposed to if we were just using implants, the only thing that you would have to worry about is recovery from a breast perspective. So during the surgery, things to know. With the breast augmentation, there are different places where you can place your incision. Underneath the fold of the breast is usually the most common. Sometimes surgeons will go around the areola, which is the colored part of the breast. There are surgeons out there that may go through the armpit. There's even a way that you can do it through the belly button. The way to minimize your risks, and honestly, in my opinion, the least noticeable scar is to go underneath the breast, because it's in a natural crease. Nobody's looking underneath your chest to see if you have a scar there. There's nothing directly on the breast itself, so if you were to be topless, there wouldn't be any noticeable scar on face view. It's a procedure that also has the least likely risk for infection and other types of complications. So I tend to always go underneath the breast when I'm doing a breast augmentation. Anytime you make cuts in the skin, there's always a risk for bleeding and infection, but that's relatively low with this procedure. And changes in sensation, though, is something that can happen. Usually it comes back after a few weeks to months, but I always tell my patients there's always a chance that your sensation before surgery may not be exactly the same after surgery. So just something to keep in mind. But with a breast augmentation, usually it's where the scar is. It's not necessarily in regards to your nipple sensation, but still something to keep in mind. For the fat grafting, they're usually tiny incisions, like less than a centimeter, that we may put in, folds around the breast that can help hide those scars. So usually in the fold of the breast, sometimes we may put one near the armpit, depending on if we need a different angle. And we're using a tiny cannula to essentially graft that fat into the breast tissue. So they are smaller scars as opposed to if you're doing a breast augmentation. And a breast augmentation scar is also not really that big. It's about 5 centimeters or less. But then you'll have your surgical scars from where we did the liposuction, from where we grafted it from, or harvested it from, and usually it's from the belly or your back. Again, those will be tiny incisions as well when you do liposuction. So as far as recovery, no matter what procedure you have done, you're going to be in a surgical bra to help support everything while things are healing. On average, I would say we limit our patients from doing physical activities for about a month. But each surgeon will have their own protocol, so you make sure that you abide by your surgeon's protocol so that you can get the best out of your results. So really it's like no heavy lifting, no exercising during that period, no heavy arm exercises. And then we're not going to want you to put any pressure, direct pressure on your chest. So that means you cannot lay on your sides because you don't want things to shift to one way or the other. I definitely don't want you laying on your chest. So you're going to have to lay on your back for a few weeks during your recovery to make sure that things heal how we want them to. So those are some things to know about breast augmentation. Again, if you have any questions or any other topics you want me to touch on, just leave them in the comments below.